employees, your clients, your customers, and the residents of our county. And it's been an enormous sacrifice. We do appreciate your diligence and your cooperation. We know that you're anxious to reopen, and we hope today's discussion will be beneficial to you as you prepare to safely get back to business. In the beginning sections of the Smart Restart guidance on pages 4 through 13, there are important safety recommendations and several tips. These would be things that would be pertinent to all businesses. So just don't focus on just your section, because there's lots and lots of extra information as well. Today we're covering accommodations and lodging in the section on pages 14 and 15, as well as cleaning and disinfecting and personal protective equipment on pages 10 through 13. This information will pertain to hotels, motels, and overnight lodging with cleaning service, along with cleaning services. Your businesses may have continued to operate possibly to a lesser degree, as demand for your services may have decreased since the stay-at-home order effective March 30th. Before we begin, we'd like to see if there's anyone who has continued to operate or has closed their business. I'm going to move on. In your work, you are required to have some contact with customers. Your goal is to do this safely in order to protect your employees and customers. And I want you to think about how you've previously operated your business, routine safety measures that you implement every day, such as disinfecting and cleaning, sick employee policies, to name a few. But we also need to think further regarding extra steps to take to protect employees and your guests and customers against COVID-19. If your building has been closed and sitting idle, it's important to make sure that you have proper operation of your building systems. One of those would be the water supply and the water system. Any reduction in water use causes stagnant and standing water in the water system, which can increase the risk of growth of Legionella or waterborne pathogens. So you need to take the steps to assure that that is safe, and then also look at your air filtration system, replacing HVAC air filters, clean or disinfect existing filters, increase ventilation by opening windows or adjusting the air conditioning, and a good deep cleaning to sanitize your facility before you do open it. During that cleaning period, you want to limit the number of workers there. There's guidance on the CDC website that advises about sanitizing and disinfectants. There's an EPA guidance. The CDC website, if you go to cleaning in businesses, will take you to the EPA that gives you approved cleaners to use. Once you're back open, it's important to educate your staff and reinforce the need for protective measures, something that they may not have been accustomed to in their work, such as wearing a face mask or face covering when working in close proximity to other employees or customers. You need to plan ahead to supply these for your employees. Face masks and coverings protect others from the wearer's potential germs. It does not protect us as we wear them, but it protects others from us. And that's an important thing, to protect your patrons, your guests, your customers from any risk of being exposed by you or your staff. It would be important to eliminate or reduce check-in or check-out with automated processes. Discourage employees from using other workers' phones, desks, offices, or other equipment when possible. I know the front desk is a shared space because different shifts work in the same area. So it should be sanitized each time after use. When somebody's going off their shift, they should clean up after themselves for the next person coming on. Employees who are ill, who have a fever or otherwise exhibiting symptoms of COVID-19 should not be allowed to work. Some businesses, different types of businesses, use a symptom checklist and take temperatures of employees when they come on at the beginning of their shift. Whatever you decide, it's important to inform your employees of your sick policy and then stick to that policy. If an employee becomes ill during their shift, you should not allow them to continue to work. If they have to wait on a ride home or a ride to medical care, have a designated area for them so that they're safely waiting away from others. In thinking about the symptom checklist, when we first started dealing with COVID-19, the CDC provided guidance of symptoms as being fever, cough, shortness of breath, or respiratory distress. That list has expanded. Other symptoms that could possibly be COVID-19, and we are seeing these, whether they have cough or fever or not. We're seeing some of these, and that would be headache, sore throat, muscle aches and pains or myalgias, kind of like you feel when you have the flu. Some people have GI symptoms, nausea, vomiting, or diarrhea. And some people report a loss of their sense of taste or their sense of smell. So it's important to, pay attention to all of those type things. Signs should be posted at entrances that individuals who have a fever, cough, shortness of breath, or other COVID-19 symptoms should not enter. There's lots of printable signs available on the CDC website. And encourage your workers to report any safety or health concerns to you, their employer. Social distancing tips in accommodations and lodging include several things. Some of these are listed on page 14 and some we've added in. You can transition breakfast to grab and go format. Things like coffee pots, microwave, drink dispensers should be sanitized between use or have one staff designated to operate those. It's important to utilize individually packaged single-use items such as creamer and sugar rather than everybody sharing a different carafe or a little pitcher of those. Restricting room service to delivery at the door only so that your staff are not entering the guest rooms. If you have a dining room or a bar that is in operation, please, or will be in operation when you're back full force, please refer to pages 41 through 43 regarding food service. You can request guests minimize direct contact with your employees, encourage social distancing in common areas, and remove or reduce customer service phones in common areas because several guests may use that phone before your employee is aware and can clean that between use. So if you're there just outside of those areas, then that won't be a problem. You need to promote frequent hand washing by employees and guests. We should wash our hands often with soap and water for at least 20 seconds. If soap and water are not available, we could use a 60% or greater alcohol-based hand sanitizer. That's per CDC guidance. We need to avoid touching our eyes, nose, mouth, and face with unwashed hands, and wash our hands after touching our face as well. Disinfection and cleaning is a key item. Providing hand sanitizing and disinfecting wipes in public areas, provide tissues and additional trash receptacles in public areas, increasing the length of time between vacancy and cleaning rooms, additional cleaning on all frequently touched surfaces, the front desk, coffee stations, doorknobs, elevators, luggage racks, cleaning those in between use. When your housekeeping staff is cleaning after a guest has left and checked out, then it would be important when they're handling linens, bed linens, and towels that they not shake those things out to bundle them up, fold them in on themselves. Another item to think about is contactless transactions. They're important. You can sanitize your point of sale equipment, including your pens, electronic payment terminals, and pen pads. Encourage your guests to use those type of things versus handling cash. But they should be sanitized after each use. I have seen in other businesses where they may slip their little keypad into a plastic sleeve so they're not spraying cleaners directly on that electronic equipment, and they're able to clean that sleeve that's over the top of it. As noted before in pages 10 through 13, it covers more in-depth cleaning and disinfecting. It covers specific surfaces and PPE or personal protective equipment. It is only effective if it's worn correctly. So you should train your employees about the correct usage. Page 12 covers applying and removing PPE. And there's a helpful chart on page 13 that shows how long COVID-19 lives on surfaces. If there are cleaning surfaces on the call, there's that. Well, I would encourage you to review more in-depth information on pages 10 through 13. Now we would like to open the call for any questions or sharing of information. But I also want to say that we are here for guidance. If you so desire, you can call directly to the health department at 336-753-6550. That's our COVID call center. It's manned by nurses. We are in the center from 8:30 to 5, Monday through Friday, but we can be reached after hours and weekends as it rolls over to the nurse on call. One last item, particularly for hotels or motels. I don't think any in our area have been asked to do this, but in some areas, hotels have been asked to provide housing for isolation and quarantine. An example would be a healthcare worker who does not want to go back home to their family may want to stay away from home in accommodations or lodging in their area. There's specific guidance provided at the ncdhhs.gov/coronavirus or COVID-19 website that addresses that specifically and specific cleaning when that should occur. And Ms. Caroline, I'm going to turn it back over to you. I think I've covered everything.
Okay. One of the questions I would like to ask you, Luann, is some of our hotels do have pools. Are there any updates in regards to that?
There are not currently. Unfortunately, that's going to be something that would come out hopefully with the next guidance in phase 2. I'm not able to even speculate because as sure as I do, the governor will tell us something different.
Right, exactly.
It's just not available at this time. I'm sorry.
Okay, well, thank you so much for taking the time. And I hope that this webinar will be beneficial to those that are listening. We wish to return to our regular lives, but we must take the necessary precautions during this time. And thank you to Luann and Susan for helping us. So again, if you have additional questions, please reach out to the Davie County Health and Human Services or the Chamber. And again, you can find this playbook on the Chamber website at daviechamber.com. Thank you, everyone. This ends our session. Have a great day.